Well, this lecture talks about social gradient of health thesis. According to this thesis, well, proposed by world-renowned public health scholar Michael Marmol, sometimes called Sir Marmol, that people higher in socioeconomic status or socioeconomic position have better health conditions than others below, both adjacent and far on the hierarchy of social stratification. Such finding is based on the couple of waves of White House study conducted by Marmor and his colleagues in Britain. And in general, they find that there is this social gradient in mortality and a wide array of health conditions and risk factors. And this publication on Lancet in 1991 by Michael Marmor and his colleagues summarize major findings from their studies about health inequalities among British civil servants based on the second White House study. And let's look at a couple keywords and sentences of their summary findings. The White House study of British civil servants begun in 1967 showed a steep inverse association between social class as assessed by grade of employment and mortality from a wide range of disease. So there's a steep inverse association. That is, as one goes up on the ladder of stratification, that is up in social class, as assessed by grade of employment, okay, or employment grade level, then less likely they're going to have all kinds of health conditions. And here is a graphical presentation using bar charts to summarize some of the results. And we have a couple of panels, A, B, C, D, and they correspond to different health conditions. And A is for probable and possible ECG ischemia, and B is angina pectoris, and C is chronic bronchitis, and D is chronic current cigarette smokers. And the different color of the bars correspond to different employment grade level, right? The black one corresponds to administrators at highest level among all three, and professional is in the middle, or executive. And clerical support is at the very bottom, so blank. And as we go down from left to right with regard to employment grade, we can see the probability of having, or the percentage of having all kinds of health conditions actually increase, right? Increase. So the first